Well, good afternoon, everyone. Minister Hagee and Dr. Fitzgerald, our Chief Medical Officer, will be joining us by telephone today. So to begin the announcement, we'll give the overnight update, and I'll turn it now over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone, and thank you to those joining us on the line and to those watching online. I'll begin today with an update on our cases. Since the media briefing yesterday, we have 18 new positive cases. Of these, 16 are in the Eastern Health Region, 1 is in Central Health Region, and 1 is in the Labrador-Grenville Health Region. It appears that the new case in Central Region is due to community transmission, as there was no history of travel or exposure to a known case. Our public health investigations are ongoing. All those considered close contacts will be advised to quarantine. This brings our total number of cases to 120. That includes 111 cases in Eastern Health Region, 3 in the Central Health Region, 1 in Western Health Region, and 5 in Labrador-Grenville Health Region. We have a breakdown of 57% of our cases are female and 43% are male. We have 11 people under the age of 20, 16 between 20 and 39, 16 between 40 and 49, 29 between 50 and 59, 22 between 60 and 69, and 26 above age 70. 2 people have been admitted to hospital due to the virus. 4 people have now recovered. In total, we have tested 1,927 people. Of these individuals, 1,807 have been confirmed negative. I want to speak now about a hospitalization at a health facility in St. Anthony. An individual was admitted to the Charles S. Curtis Memorial Hospital. The patient had tested positive for COVID-19. At this point, we understand the patient did not travel and did not have contact with a confirmed case of COVID-19. So it appears this is a case of community transmission as well. Patients who were in close contact with the confirmed case have been provided with information about the virus. They are being tested and are in quarantine. The staff who had close contact with the confirmed case have been identified. They are currently in self-isolation and are being followed up by public health. Contact tracing began after receiving the patient's diagnosis as per routine public health protocol, and those who had close contact are being followed up by public health. The affected patient is in hospital in isolation with all the appropriate precautions in place. This includes the use of personal protective equipment for staff who are caring for the patient. A testing and assessment center opened in St. Anthony today. This center will support the increased number of people requiring assessment. Labrador-Grenville Health has been working with us on planning for COVID-19. The planning they have in place enabled their staff to act quickly and helped reduce the risk of spread of the virus for staff and patients. The health and safety of the population remains everyone's top priority. All health regions are working in tandem with us. As a province, we continue to work closely with our federal and provincial and territorial counterparts. Our public health system is responding, taking action, and working well. The health system continues to work diligently, and I commend everyone for their actions and responsiveness in this situation. To summarize, there are 18 new cases since yesterday's media availability. The total number of cases in the province is 120. By health regions, we have 111 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 5 in Labrador-Grenville Health. We now have known community transmission in the province. This is a significant development. We have said on many occasions that we need to behave as if this virus is circulating in our communities already. Today, we have proof that this is true. I am calling on all of you to do your part to reduce the spread of COVID-19 in our province. Stay home unless it is essential, and by that I mean groceries, medical supplies, hygiene products, and essential work. Do not hang out with your friends. If you must go out, maintain a physical distance of 6 feet between yourself and others. Wash your hands well and frequently. Finally, and I cannot stress this enough, if you are sick with cold or flu-like symptoms, you must stay home. It is all of our responsibility to flatten the curve. Our collective actions will have significant impact on how COVID-19 progresses in our province. And I thank you for your time today. Back to you, Premier.
Thank you, Dr. Fitzgerald. These are somber messages for Newfoundland and Labrador. Today is Saturday and a weekend. I hope you and your family that are listening and watching today are making the adjustments as best you can to deal with the healthcare crisis that we're dealing with within our province. As in the past and every day, we're continuing with our regular meetings, our updates every day with our health officials and our all-party committee. For some of you, and it's turning out to be what is a routine for all of us and a routine for all of you. But I will stress again, as Dr. Fitzgerald just said, that we cannot take this situation too serious. We must do our part. Let's not take these routines as we see today something that can be for granted. They are not. Rest assured that we will do everything that we can to support you, your safety, and your health through this challenging time. Thousands of you, I know, have been joining in every day for the updates on various media platforms. So once again, I want to thank Dr. Fitzgerald and Dr. Hagee for sharing the information with the number of cases and the demographics of those that are infected in the past. Those updates will continue. We've been in a public health state of emergency for weeks now. I know this has been a big adjustment for your daily routine as we make our way through this pandemic together. It is important that we continue to follow the guidelines in the strictest manner possible. What is sombering today is that we have the highest infiltration of cases in the country in Newfoundland and Labrador, next only to Quebec. This is the highest number of 100,000 people. It's Newfoundland and Labrador. We are number 2 in the country. So we cannot let up. Today, there will be a stark reminder going out to the province this afternoon with a text alert message. This will be a critical reminder for everyone to stay at home. And for travelers from outside our province or traveling into our province, regardless of your origin from another province or an international traveler, the message will be self-isolate for 14 days on your return to this province. Over the last few days, we've mentioned some of the great community efforts that we've seen throughout the province, where people are providing supports while keeping physical distancing and safety at the forefront. There's been lots of talk about truckers who are providing essential services for people in Newfoundland and Labrador. So today, we're happy to be able to report that Marine Atlantic has teamed up with a well-known group in our province, the Salvation Army, to provide commercial truckers with supper who are overnighting, waiting for the Port aux Basques crossing tonight. I've heard they've even have a very hot meal cooked up to support these commercial drivers who are providing essential services to Newfoundland and Labrador. Now, speaking of essential goods, people that live in our communities, will you have options to go online if you require essential goods, especially our seniors who can call the Red Cross also for support lines. It's by using the online services that we can keep the social distance and the physical distance as required to help push back the spread of COVID-19. Shopping online for those essential services helps us stopping the spread and slowing the spread of COVID-19, plus it will support the local economy. Now today I also have a few things that I want to announce. Due to the concerns of COVID-19 and the global pandemic, the 2020 Newfoundland and Labrador Summer Games that were scheduled to be held in Bay Roberts in August will be postponed. Because of the current public health state of emergency, all sport facilities are closed. Athletes are not able to train in a regular way. No playdowns are not happening, and teams just simply cannot be selected. So working with the department and with the town of Bay Roberts, the decision has been made unanimously and with mutual agreement to postpone the 2020 Summer Games. Now the provincial government recognizes that these athletes, this is disappointing, but we recognize that these athletes, these sporting organizations, the sponsors, and all the organizers, they've put a lot of work, and I want to thank you, but realizing that this is a postponement, not a cancellation. This decision is very consistent with what we've seen with other sporting organizations around the world, including the International Olympic Committee with the canceling of the Olympics in Japan this year. Announcements like this are not easy. They seem a long way off. But we know, and people in this province should know, that we are seeing this not as something that could last days or weeks, but months. So the decision, as late as August, moving this decision and postponing this today, is the right thing to do. But I do want to recognize the work and the time and the dedication of the coaches, the families, as I've mentioned, the sponsors that have done some tremendous work on this. This, again, these games are postponed. They are not canceled. So we look forward to working with the community of Bay Roberts and to rescheduling at a later date. Today, I also want to take some time to recognize that this is a challenging time for many people as we ask you to stay home. We recognize the strain of the situation is placing on many people, on families, particularly those living and with an increased exposure to violence. I want you to remember that you are not alone in this situation. As a province, we are here to help. There are resources that are available to you, and I encourage you to visit our violence prevention website at gov.ca/VPI. There you can find information of the services that are available in your communities and within your region. And as always, if you are in immediate distress, you need help, call 911. We are also working with the Federal Department of Women and Gender Equality on this very issue. As part of an aid package, the federal government is recognizing the need for more resources and is providing funding to organizations that will work directly with women who are facing violence. Our own Office of the Status of Women and Justice and Public Safety is working with their federal counterparts to ensure that the funding moves quickly to those groups who are on the ground offering vital frontline services to those in need. Now, we need to be clear. Regardless of the troubling times that we find ourselves in, make no mistake, violence of any kind cannot be tolerated. We will continue to do everything that we can to keep you safe during this difficult time. I want to remind everyone that's listening and watching today, we know that doing everything, we know that you will do everything to support you, and to support your neighbors, and to support your communities. We are all there to protect you and support you during this difficult time. So we're working with our colleagues in the federal government, and we're meeting every day with our health officials here in the province and federally, and with our all-party joint committee, working very hard on your behalf to support you. So we've made some tough decisions. We've put some tough guidelines in place, but you can see with today's announcement of 120 cases in Newfoundland and Labrador, moving in all regions of this province, we must do everything that we can as a community by working together to stop the spread of COVID-19 through Newfoundland and Labrador. So we ask you to continue to abide by these guidelines. We see the impact of some of the most vulnerable in our society, our seniors, potentially impact. They deal with this in a very different way. The onus on us, the responsibility is on all of us to stop the spread, especially to the most vulnerable in our society. So let's all continue to work together. We really appreciate the work that our community groups are doing to support those that are providing those essential services. And once again, thank you to all our healthcare workers, those workers within our grocery stores throughout this province, providing the essential services. Those people that are working in our communities, and they are in every community throughout Newfoundland and Labrador. We cannot thank you enough for the work you're doing during these troubling times. So we'll now turn it over to Dr. Hagee, the Minister of Health and Community Services, for a few comments.
Thank you very much, Mr. Premier. I think it's another opportunity to re-emphasize Dr. Fitzgerald's message about the numbers today. We've seen them rise again, she, like I, have taken the opportunity to work from home for the weekend, and I would encourage all of you who are able to continue to work from home, that is your preferred site to work. I think I have tried to emphasize the prepared state of our RHA facilities as we look towards an increase in numbers and an increase in people hospitalized. You can see the trend is still showing anywhere from 15 to 20 new cases a day, and as yet this doesn't show any signs of leveling off. We have no opportunity here to be complacent at all. What I would like to say is that each of our regional health authority facilities that takes acute admissions is able to manage patients who present with COVID-19, and that each of our long-term care facilities has protocols in place should any of their residents contract the disease. We have moved towards virtual care for primary care, and we now, as of last night, have 338 providers able to offer this service across the province. I applaud those who moved rapidly into new technology in an area they may not be familiar with, and I would encourage their colleagues to do the same. I would encourage patients to use these facilities wherever possible. If you have broadband, then video conferencing is an option, and if not, then the telephone will work just as well. I have had information from a practitioner who used this for her full day and found it a perfectly satisfactory way of seeing over 30 patients in the course of a day without anyone meeting face-to-face with anybody else. We have seen an increase in demand for mental health services. It is normal under these circumstances to feel anxious, to feel scared, and with the amount of news coming to you from mainstream media round the clock, and Facebook and social media, to feel actually overwhelmed by it all. And I would encourage you all to take a little bit of a break at some point in your day and actually put your phones away and turn your TV and your radio off and just spend some time thinking about some of the other things that are important in your life. We have a lot of people in this situation. You are not alone, and we have services here that will help you. We have our mental health and addiction staff. Doorways clinics have been deemed essential. We have the warm line, we have the crisis line, and we have 811. And I'd like to take this opportunity to thank the staff who work on those lines and in those areas, because they too are feeling the strain. They take on some of the burden and some of the problems of the people who call or interact with them. They are there for the vulnerable, and they are there as a voice of calm during COVID-19. We have had an increasing reliance on 811, and we have made significant improvements in staff and lines to meet the challenge. We've seen the number of people awaiting callback now drop again for a second day running, and we're now down to 83 individuals who are waiting a callback from an RN. If you call 811, do not hang up. Your call will be answered in priority, and the average wait time is now down to minutes rather than hours. If you are one of those individuals who is told that you will get a call back, it will be a number you may not recognize. Please pick it up. 811 will not leave a voicemail for privacy reasons, and it becomes difficult. We've had people who simply have not answered their phone, so if you know you're going to get a call back, be prepared and stay near your phone. The important message at the end of all this is that we can do the best we can to help reduce the spread of this virus. The virus only moves when people move. If you do not move, the virus cannot move. And as Dr. Tamar, Medical Officer of Health for Canada, said yesterday, make a bubble of protection, stay in it, and don't burst anyone else's. This is what we have to do. This is what is crucial, and this is what will make a difference. So I have seen on Facebook and other social media people having virtual shed parties rather than real ones, and I would encourage you all to do the same. Please, now is the time to maintain social distancing and social connectivity by new means. With that, I'll conclude my remarks and hand it back to the Premier. Thank you.
Thank you, Minister Hagee and Dr. Fitzgerald. We now turn it over to the media for questions.
For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will be given the opportunity to ask 2 questions and 1 follow-up. We will run through the telephone queue, so each reporter is given an opportunity. Following this, should time permit, I will ask if there are further questions. This call will end at 3:29 p.m., and further questions can be emailed. Operator, please proceed.
Thank you. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience. The first question is from Meg Roberts, CBC News. Please go ahead.
I would just like to ask how concerned we should be about having community transmission now.
Hi. So I think this is a new development. It's a significant development. We have been expecting this. It's happened in other provinces. It's not surprising that it's happened here. We've been saying all along that we need to believe that we need to behave like we have community transmission. This confirms that we do, and I think, obviously we are concerned about any transmission that's happening, and I think this means that we have to be more. It just reinforces the fact that we have to be so careful now, staying home and ensuring that we're not spreading any virus.
With community transmission, now are we expanding our testing to include not just people who've traveled or have contacted with a positive case?
So those are questions that we are addressing and readdressing every day. Right now, we are certainly testing anyone who has been in close contact with a known case, and we're focusing our efforts at the moment on doing the contact tracing of the cases that we know and testing that way. Once we have reevaluated the evidence and the information that we have, we'll adjust our protocols as necessary.
Based on the numbers over the past few days, do you think that we are on a sustainable trend?
Okay, go ahead, Minister. No,
Thank
that's
you very
fine.
much. I think the important thing to realize is we don't know where these numbers will go, and a lot of what we do now and what we have been doing since the state of emergency was put in place will determine the path those numbers take. The things I spoke about yesterday about the preparations made within the regional health authorities and acute care facilities are the next line of defense. We have nearly half our beds in acute care facilities empty and prepared to take patients with COVID-19. Every acute care facility has the ability to manage these and the staff to manage these patients, even though we have seen some staff taken out of the pool, as it were, for self-isolation, particularly around the calls, a funeral home, but also now around potentially an issue in the Northern Peninsula. So that is our next layer of defense. In terms of sustainability, the key is that our rate of number increase should never exceed the beds that we are able to provide and have available. And we'll only be able to see that with time, but at the moment, what modeling can be done would suggest that we are in a position where we will have the resources to sustain this.
Thank you. The next question is from Kelly Ann Roberts from NTV News. Please go ahead.
Thank you. Of these new cases announced here today, are any of them linked to long-term care homes?
None of the new cases today are linked to a long-term care home, no.
And there is a rumor, an ostracized rumor, going around social media, which is causing a lot of fear, that a person who has tested positive was at Costco today. Can we confirm or deny this?
We're not in a position to confirm or deny that. We have seen those comments, and we will try our best to investigate them. But it is somewhat difficult to pin down on the information that's currently reliably out there. From the point of view of this, if that is the case and the person has not fully recovered and is one of the small number who have, then really this is utterly irresponsible, cannot be condoned. And we have the ability under the orders that the Chief Medical Officer of Health, or indeed any medical officer of health, can make to manage that situation. And you've seen those powers exercised already. We have those. We would much prefer to educate and encourage, but if need be, we will enforce.
Thank you. And we've had a lot of people reaching out when it comes to the 30-day pharmacy refills having been shortened from 90 days. We're seeing the dispensing fees not change in accordance. A lot of seniors reaching out very concerned because what they would normally pay is now increasing because of the shortened days. Is there any work being done to help alleviate some of these strains?
The short answer to that question is yes. It was a topic of discussion in the department yesterday. The change to 30-day dispensing is a standard of practice mandated by the Pharmacy Board. That is the regulatory body for pharmacists in this province, and they are bound to do that. However, the issue of dispensing fees is slightly different. So we are working with the pharmacists associations to see how to alleviate the burden on seniors and indeed on anybody. Certainly, our rough estimates at the moment suggest that the extra in dispense fees would cost the drug program alone in Newfoundland and Labrador another $5 million over and above what we already spent. So that is only a small fraction of the total cost, because the majority of medications for our population are paid for out of pocket or through insurance. So it's obviously a significant concern, and we're working to see what the art of the possible is with the pharmacists.
Thank you. The next question is from Elizabeth Whitten from CBC Newfoundland and Labrador. Please go ahead.
So far, 4 people have recovered from COVID-19, and I'd like to know, what is the procedure or process for declaring someone free of the virus? Are their symptoms just gone, or is like another test administered?
Research has gone into this, and right now the recommendation is that if somebody is 10 days after their symptoms have started and they have had a resolution of their symptoms, so they have no fever, they're feeling well, then they can be considered recovered. There are exceptions for healthcare workers. We're obviously more diligent about ensuring that healthcare workers are recovered, so we will test them to make sure. And if people were in hospital and had more severe disease, we're a little more strict with regard to what's considered recovery in that case. But for most people who've had mild to moderate disease, it will be 10 days after the onset of their symptoms, provided their symptoms have resolved.
Right. And what are the guidelines to how they should behave afterwards? Or are they just told, like, join the rest of us and, keep social distance, or are they followed up with by public health?
No. So once they're considered recovered, they're considered recovered, and we would have the same recommendations and rules in place for them as for everybody else with regard to social distancing and ensuring that they were washing their hands well. There are other respiratory viruses that they can pick up, and we certainly wouldn't want them to get ill with any of those, given that they had just been through COVID. So it is important to maintain all of the same precautions that everyone else is maintaining at this time.
Right. And have these 4 cases been subtracted from the grand total, the numbers that we get told every day, updated on?
No. So those are cumulative totals. Will have all people who have been diagnosed included in there. So we report those separately. Recovered is a separate category from the cumulative total. Right? So our numbers don't change with regard to the numbers of diagnosed people that we've had.
Thank you. The next question is from Andrew Robinson, The Telegram. Please go ahead.
Good afternoon. With the situation in St. Anthony, you mentioned amongst the people who are quarantining are some staff from the local hospital. Given St. Anthony is considerably isolated as a rural community, far off from other, I guess, municipal kind of centers for regions. Is there any sort of planning to address any potential staffing shortages, keeping in mind the fact that St. Anthony may be working from a smaller pool, say, than an area like St. John's or Gander, Grand Falls, Windsor, that sort of thing?
That's a very good question. I've been in discussions with the CEO of Labrador Grenfell. She advises me that given the bed occupancy and their staff pool currently, they do not foresee any issues. Obviously, it's something they'll monitor as time goes by. And as the numbers of staff firm up in terms of who is able to work and who is not, she and her advisors will be in a better position to be a bit more definitive. But at the moment, we are not anticipating any operational challenges there.
This question is to kind of, I guess, more reiterate something that's been covered in the past. I've been in touch with some people over the last couple of days who've returned to Newfoundland from the United States, and they seem to have fairly divergent thoughts as to the limits of what they're allowed to do in terms of stepping outside their front door. I'm aware of one person who wasn't sure if they could go to their back shed to retrieve some wood to bring into their house for the wood stove. On the flip side of that, I'm aware there are people who've gone for walks around their community while keeping in mind social distancing practices, but are still leaving their own home property to and going outside. So I guess just some clarification perhaps on what exactly are the limits of stepping outside your front or back door.
Hi. So if people are returning from travel, we certainly want them to stay at home as much as possible. If people want to go outside around their property, on their property, that's certainly okay, as provided that they are maintaining the recommendations for social distancing, 6 feet apart, that sort of thing. We would like people who have been traveling and returning from travel to stay on their property as much as possible. We are sort of reviewing these recommendations at the moment, and we'll have more information in the next 24 hours or so.
There is currently on our COVID information website a very good guide to the current recommendations for how to do isolation, self-isolation, and also some details on that kind of activity that's permitted. And as Dr. Fitzgerald's referenced, that may change from time to time, and I would encourage anybody who is in doubt to use that as a reference point, because that is the most accurate and up-to-date, and we will aim to keep it that way.
And it's important too, building on what Dr. Fitzgerald said and what Dr. Hagee said, is that if these are for people that are asymptomatic, if people would start demonstrating signs of symptoms, well then it's important then to isolate and even protect yourself from your own family members as much as possible, given the confines of your own house. So, if you start showing symptoms of COVID-19, it's important that you keep social distancing, as it is for all cases, but also to self-isolate.
Thank you. The next question is from Allison King, VOCM News. Please go ahead.
Hi. Firstly, I'm just wondering if you're able to tell us where exactly the community spread took place.
In Central, you mean, or in?
The case that you saw reported today with the community spread, is there a location on that?
At the moment, the information I have is in Central, and that's as much as I can give at the moment.
Okay. A follow-up to that, can you tell us if the community transmission was likely spread by someone who was not showing symptoms, or if they were showing symptoms?
So right now, the person who has been diagnosed is symptomatic, but because it's community transmission, we don't necessarily know who they got it from, right? So it's difficult for us to say if that person was symptomatic or not. That's the difficulty with community transmission, is that we can't always trace it back to a known source.
Thank you. you. My final question, will community spread prompt the government to suspend travel throughout communities in the province, especially if we end up seeing more similar cases in the coming days?
We haven't contemplated restricting travel within the province. We've had very strict early limitations on international and then within Canadian border travel. At the moment, these are decisions that were made on the basis of medical officer of health, public health advice. Obviously, if we get another hotspot like we did with calls, then that would be a discussion that we would have. At the moment, though, we have not found a situation where, from a public health advice point of view, it crosses that threshold.
Thank you.
And I would add to that, Minister, that, as I said before, we need to behave as if community spread is happening everywhere. So it doesn't change what we need to do, whether we restrict travel or not.
Thank you. The next question is from Michael Tutton, the Canadian Press. Please go ahead. Mr. Tutton, if you are on mute, please unmute your line.
Can you hear me?
We can.
Okay, thank you. In terms of the community spread, can you tell us how it happened at all? Was it a social event? Something about how it occurred so that the public can avoid that kind of thing.
So at the moment, I don't have that information. With most community spread, we don't find or incidents like this, we often don't find a source for the spread. A person becomes positive or is tested and is positive, and when we try to trace back if it's been related to travel or if it's been related to an event or a known case, we can't find that person. So we often cannot tell what the source was, which is really the definition of community transmission.
Across Canada, people are asking, why don't we have more testing? Testing of people coming back from traveling, testing of transport workers, testing of hospital workers, testing of the paramedics who are sitting at home unable to work. Is it a shortage of test kits? Is it an inability to buy test kits? Why is this happening?
Part of the issue is around the value of testing people, the predictive value of testing people who actually have no symptoms at all. The literature is out on that. The verdict is out on that. There is no clear guidance to suggest that is of any benefit. So the decisions around who gets tested are currently based on public health and best medical advice. We have made several strides in our labs to ensure our capacity there is adequate and will be expandable to meet any demand from a need for increased testing. We currently have a reasonable supply of test swabs, for example, and Health Canada indeed licensed a couple of new brands very rapidly to allow us access to those too. Our biggest challenge still remains, however, around sourcing increased amounts of personal protective equipment. That is a national, indeed a global challenge, because most of this equipment, until very recently, was made in Hubei province, centered around the city of Wuhan. So we are looking at supplies outside of our regular supply chain, as well as our regular deliveries. We have had some through our regular supply chain. We've also had some from the National Emergency Stockpile. So whilst we are in a better position with PPE than we were, certainly that is a challenge that we continue to look for a solution for on a daily basis almost.
Dr. Stanfield Underwear in Truro, Nova Scotia is talking about ramping up production from underwear to PPE. So would that be helpful?
Any source of PPE that meets the specification, and that's the real crucial thing, is always welcome. we've been working with entrepreneurs within Newfoundland and Labrador to look at options to repurpose manufacturing equipment to manufacture gowns and nitrile gloves and those kind of things. The key is these products must meet specification, because the worst thing would be to equip our frontline staff with material and equipment that was not going to protect them. So yes, anything we can do to increase the supply is great, but that supply has to meet spec.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. Please press star 1. Next question is from Kellyanne Roberts, NTV News. Please go ahead.
Thank you. The majority of the cases, are they symptomatic, mild, severe? Are we seeing more of one than the other?
The majority of cases are mild to moderate. We've had 2 people that have been hospitalized, but otherwise most people are at home.
Those that have been hospitalized, are ventilators being used in those cases?
So that would be discussing significant, there would be medical privacy issues with discussing those.
All right. And many healthcare workers are concerned that people, in terms of proper hand hygiene, are having false security with hand gloves. Can you, I guess, speak to how important hand hygiene is and how false gloves can give a sense of security?
Yeah, so that's a good point, actually, and one that we need to reiterate often. A lot of people think if they wear gloves that they're safe. Gloves still touch all the same things that bare hands touch. So if there's anything out there that's contaminated, the gloves will be touching that. So if you touch your face while you have gloves on, you're still transferring potential germs to your face. It is an extra layer of protection, but it does not take the place of careful hand washing. So when you take the gloves off, you need to make sure you either wash your hands with soap and water afterwards, or you apply alcohol-based hand rub and make sure you cover all of your hands. The other concern, of course, is that when you're taking off your gloves, that you can contaminate your hands while you're doing that. So that's why it's really important to make sure you either wash your hands or use alcohol-based hand rub with at least 60% alcohol after you remove your gloves.
Thank you. The next question is from Meg Roberts, CBC News. Please go ahead.
I was just wondering, are the people who have recovered still at risk for the disease?
So the information we have with regard to whether or not people can get reinfected, I think that's what you're aiming towards there. That information is still not conclusive. It certainly appears that there is limited protection against the disease. However, we know with other coronaviruses that protection is not necessarily long-term, and so if you get a cold one year, you can certainly get it another year. It doesn't confer lifelong protection. So the jury is still out, I guess, is the bottom line. So we would urge anyone who is recovering to still maintain those same cautions that we're telling everybody else with regard to hand hygiene and making sure you're socially distanced and all of those measures.
And a question about the truckers. Is the Salvation Army providing meals and shelter for truckers because Irving and other major truck stops and gas stations maybe are no longer welcoming them?
No, that's not the case. We've also spoken with Irving and North Atlantic, who provides service stations across our province, and they are, obviously have washroom facilities and so on, and plus limited amounts of food available to the trucking industry and others as well. The idea here with the Salvation Army, when we reached out to them, and we could potentially, even though we're in Port aux Basques today, that service is ready to be expanded based on what would be regular stops for truckers across the province. So it's not the case. It was just, again, having a discussion with Marine Atlantic and the Salvation Army, who were prepared to step up again, as they do quite often, to meet the demand and give those truckers leaving and entering our province a hot meal as they continue on their journey.
Thank you very much.
Thank you. The next question, Allison King, DOCM News. Please go ahead.
Premier, can you provide any update on social assistance checks with mail services being shut down?
Yeah, we can. And so right now, the next pay, people would expect their pay on April the 1st. So there's between 2,000 and 3,000 checks now that will be ready to go out. So the provincial responsibility would be for things like income support, support enforcement, some landlords that still receive checks by mail, some pensioners, and so on. So we have between 2,000 and 3,000 checks that are ready to go into the mail to get into the hands of those in Newfoundland and Labrador between now and April the 1st. We are working also with Canada Post because we also recognize that by April the 3rd, which will be late next week, that GST checks, which would include the provincial portion of the income support that we put for seniors and those low-income earners in our province, because it's on April the 3rd that additional amount of money should be in the pockets of Newfoundlanders and Labradorians as well. So we're currently working with Canada Post for those two dates, but we'll make provisions for the provincial portion, April the 1st, to get into to be delivered to those recipients, and for April the 3rd, working with Canada Post for the second part of the delivery of mail to those that would be impacted by those checks.
Thank you. My other question, what specific measures will child care centers opening for essential workers be taking to ensure the safety of the workers, children, and their families when it comes to COVID-19?
Which group was that? I missed the first part.
What specific measures are the child care centers opening for essential workers going to be taking? Yeah,
so we're working now on a number of different scenarios. So the objective here is, and this is about child care spaces for those that would have missed the first part of the question. So this is really making sure that we have child care spaces available for essential workers. And for what we're working with the group right now, including we've had some conversations with the Nurses Union, Debbie Forward, with Jerry Earl from NAPE and others. So we've got a fair number of applications that are in. We've had our staff in late last night that are calling individually, calling those individuals to look at the types of scenarios, realizing that if we can find those childcare spaces with family and friends, that would be the best option. Would be lower numbers, of course, and social distancing and other practices that will be put in place is better in those situations. Then for those who cannot find a family or friend to provide childcare spaces for those essential workers, we'll be working now for other options, which could be including the childcare operators and the spaces that we have available across the province. But the commitment remains to provide free childcare for those essential workers that provide the services to Newfoundlanders and Labradorians, that we will be providing free childcare spaces for those workers.
Thank you.
Thank you. The next question, Andrew Robinson, The Telegram. Please go ahead.
Thank you. Based on personal experience, I find that people with facial hair can be predisposed to touching one's face. If that happens to be the case for someone, from a public health perspective, do you think it's advisable for people in this present situation to consider shaving off their facial hair?
I think there's go ahead, Dr. Fitzgerald.
Okay. We don't have any recommendation from a public health point of view with regard to facial hair. We make the same recommendations to people to avoid touching your face, and that's difficult for people with or without facial hair. Has been my experience personally. We do have recommendations from healthcare workers who need to be tested for certain types of masks with regard to facial hair and it interfering with the fit of those masks. So we do make recommendations in that situation, but otherwise there's no public health recommendation.
So I think it goes back to the first principles that Minister Hagee often refers to, and Dr. Fitzgerald often referred to. Is the first principle is keep yourself safe. Protect yourself from the spread of COVID-19, and doing so, you will help reduce the spread to your family members and loved ones and friends around you. So take whatever the appropriate measures would be. You make that decision on your own. But the fact is that take the measures to protect you and your family from this spread. If that includes shaving off your beard and you're more comfortable with that and you think it better protects you, then be reasonable. Do what suits you best.
Thank you. The next question, Kellyanne Roberts, NTV News. Please go ahead.
Thank you. Of the cases that were announced today, the 18, we know the one in Central you said is from community spread. Do we know or can we link the other 17 cases?
The one in Central appears to be community spread, as does the one in Labrador Grenfell Health. The rest, I don't have. The investigations are ongoing for those in Eastern Health, and so I don't have that information at this time.
Okay. And in talking about College Funeral Home, is the exposure still only limited to March 15th, 16th, and 17th, or are we widening that exposure days, those exposure days?
No, the exposure dates are those dates. The investigation has widened, of course, from the people who were just at the home to contacts of people who were at the funeral home as well. So, but the dates are the same.
And I know we say how we act now will determine the path that the virus takes over the coming days. Are we anticipating any relative time for peak, though?
No, at this time it's still difficult to say. Many of our numbers right now are related to this one cluster, either directly or indirectly, and that will have an influence on what we see right now. So it's difficult. It's still early days. We are analyzing the data, and we hope that we will have some predictions at some point in the near future. But at the moment, it will be too early to say.
Thank you. The next question, Elizabeth Whitten, CBC. Please go ahead.
I'm not with the CBC unless I've been hired unknowingly. I'm Elizabeth Whitten with All Newfoundland. No worries. I'm with All Newfoundland Labrador. I had a question for Minister Haggie. A week or so ago, you said 20 ventilators were on order, and I was wondering if they'd arrived and if more are on order.
The ventilators we ordered have not yet arrived. We, through the federal government, are in discussions with a company in Ontario that makes and has done for some years ventilators for the global market. They have agreed to do two things. One is to devote their entire output to the Canadian market, and the second is to treble their output to about 500 ventilators on a monthly basis by operating round the clock. We have a 50% excess of ventilators over and above the ICU beds we have in the province as well. So we have a relative, we're in a way better position for ventilators than a lot of major metropolitan areas, for example, in other jurisdictions or in the States. So at the moment, we're keeping an eye on it. But so far, our ventilator usage is down around 13%.
I think this goes back to the earlier question about someone in acute care using a ventilator. Well, even though, obviously this would be personal information, but there would be no one in the hospital right now that would not be using a ventilator because of access to ventilation, as Dr. Haggie just mentioned. So the equipment is there, but I will say from a national perspective, this is a topic of the discussion, and we're seeing places like Ontario now that are changing some of the manufacturing sites to manufacture ventilators that would meet the standard for use in hospitals within Canada right now. So we're seeing a number of companies in Ontario being retrofitted to manufacture ventilators, and this is a topic that often comes up on our national calls. But Dr. Haggie is right. We are in a better position with the numbers of ventilators available than most other provinces.
Right. And as a follow-up to that, do any of the incoming ventilators kind of have a final destination in the health regions, or are they not being allocated yet?
We have a kind of mutual good neighbor agreement, both across the RHAs and actually across the Atlantic provinces for equipment under these circumstances. So at the moment, again, it relates to discussions like were had yesterday. The equipment would be sent where it was needed. The pressure points may vary from time to time as this pandemic unfolds. As yet, we've not had to look at reallocating equipment from a relatively quiet area to a much busier one. That may come, and we have plans in process to be able to do that fairly rapidly. But at the moment, they would be generic and available for anywhere in the province. They've not been allocated to a particular RHA or a particular facility.
And that is true. That is true for Newfoundland and Labrador, but we can even expand that. That is true for good neighbor agreements that we would see amongst provinces as well. Most provinces have said that if other provinces are in demand of something like ventilators, as has been just mentioned, that they too are willing to cooperate with any one province that could have a need or need more based on the capacity that they would have. So these good neighbors agreement are signs of cooperation from regional health authorities, as the minister just said, but also amongst provinces as well.
Thank you.
Thank you. The next question is from Meg Roberts, CBC News. Please go ahead.
Have you found anyone from Call's cluster that has tested positive but was asymptomatic? And if so, were they able to spread it?
To my knowledge, that hasn't been the case at this point. So we don't have that information with regard to spread.
I think some people are still wondering about essential services. We've seen some comments regarding why are car dealerships still open, and we're wondering why they have not been closed.
Well, I think when you look at the definition of essential services, and as we've said, quite a few times now, realizing that this is not just a few weeks, this will be months. So what could be essential, for 1 week, as Minister Hagey has said quite often, may be something that is essential over a 3-month period. Also realizing, that places also provide services to support essential workers, also provide services to those that would have to travel to pick up groceries over, the long term of this event, to travel to appointments that would be necessary, healthcare appointments that are still ongoing around the province. Because keep in mind, even though our big focus today, as it should be, and our priority is on COVID-19, there are still a lot of people out there that deal with other health issues and other personal issues as well that still need to be able to have methods of transportation and access to essential services across the province. So, what's essential may not be seen as essential today. Over the long term of this COVID-19 will be essential over the long term.
Thank you.
Thank you. Next question, Kellyanne Roberts, NTV News.
Thank you. Just wondering, of those first responders and frontline workers that have, been exposed or been in contact with not only the St. Anthony case, but I guess other cases across the province, how they're doing?
So the question there, Dr. Fitzgerald. Yeah, so the question there, if you didn't hear it, would be about the healthcare workers in St. Anthony.
So my understanding is that all are doing well. Anyone who has been diagnosed has mild to moderate, except for the 2 admissions that we've had. So I think most are doing well.
Great. Thank you.
Thank you. There are no further questions registered. I will return the meeting back to Ms. Nick-Payton.
Thank you very much for tuning in, everyone. The time for questions has ended. Thank you very much.
Thank you. The conference is now ended. Please disconnect.